Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is 5 things that you should know about epidural steroid injections. They have been performed since the 1950s, so for over 60 years, epidural steroid injections have been a mainstay in pain management, with the purpose of relieving the pain from pinched nerves. And most commonly, these are performed with cortisone, which is the medical term for steroid medication. The first thing you should know is what are the indications for an epidural injection for pain management. Now, first and foremost, you're going to do these for what you see here, which is a disc herniation. This is a spinal disc, and a piece of it is squeezing out. That's called a herniated disc, and it's pinching on a nerve root as it tries to get away from the spinal cord. Okay? You can see the redness there. It's inflamed. The steroid medication bathes that area. So the second indication would be for spinal stenosis. And you do end up with the same concept of a pinched nerve, but a lot of times it's from arthritis with soft tissue and bony overgrowth. So it's not necessarily from a disc, but and it's often multiple nerve roots affected. And the third one would be for a degenerative disc disease where you have irritated nerve roots. You may not have a disc herniation. It may be intact here with a tiny little tear that's causing inflammation, and that's seeping around the nerve root, causing inflammation. So the second thing to know is how exactly does an epidural steroid injection work? Well, as I mentioned, it's cortisone, which is a steroid, and it's a hefty anti-inflammatory medication. So it's not going to cure this type of problem here, right? It's just going to bathe the area with soothing steroid medication and decrease that inflammation and give you pain relief and give you time as a Band-Aid for this piece of disc to disintegrate away. Okay, so it's often very effective for that. And that steroid medication that gets put in there can stick around for weeks to months and provide pain relief during that time. The third thing to know is that there are 3 different types now of epidural steroid injections. There are interlaminar, this should be interlaminar, transforaminal, and caudal. I'm going to go through each of these. Interlaminar is when the needle goes through the lamina. Lamina is a bone here on the back of the spine, here on the back of the spine, and there's an area between the two that has soft tissue that just kind of poke through it, and before you get to the spinal cord, you inject the cortisone, and that bathes that area that's being pinched. So that's the one that was invented first back in the 1950s. It's still done today, and it works very well. Transforaminal is the latest one to be invented, and that's gained incredible popularity over the last decade. And that's when the needle goes right around the area where the nerve root's being pinched. Okay, it doesn't go back here, it goes on the side, so it gets the steroid as close as possible to the area that's being pinched, and that's been shown to work exceptionally well. Now the third type is called a caudal epidural, and here you have the lumbar spine here, the sacrum, you're looking up from the bottom, and this is where the needle goes into a small hole called the sacral hiatus, and a larger amount of steroid is injected, and it migrates up, and it can bathe multiple areas of nerve roots being pinched, and that works very well for a situation like spinal stenosis, where typically multiple nerve roots are being pinched. One injection may take care of all of that. So the fourth thing is, what are the outcomes of spinal epidural steroid injections? There's been dozens of studies performed in the last couple decades, and overall, if you average them all together, 3 out of 4 patients, 75%, get good to excellent outcomes from the procedure. Now, studies that were done before that did not usually include x-ray guidance, and they didn't randomize patients either, so you can't really seriously evaluate those, but the dozens that have been done with those protocols have typically shown good to excellent results, like I said, in 75%. Some higher, some lower, but that's the average. So here's one that was recently from last year. A prospective study of patients looking at with radicular pain caused by degenerative lumbar spinal stenosis found that after the transforaminal injections, 3/4 of the patients had at least a 50% reduction in pain. Almost 2/3 had improved walking tolerance, and 57% had improved standing tolerance up to 1 year follow-up. So that's a very long duration. I mean, think about it. If you have a year of great pain relief, it wears off, you just have the procedure done again. So the fifth thing is that these are not FDA-approved procedures, and they haven't been evaluated by the FDA. It means they haven't been approved or denied. So they're used off-label, that's how it's called, just like 40% of medicines, and that's from the AMA. Lots of treatments work very well for indications that they were not initially approved, right? So just because someone says, oh, it's not FDA approved, you shouldn't get it done. Well, that's not an accurate description. It was approved for something else, and then doctors found that it worked well for, pinched nerves, so it's used routinely. So that's not a knock against it. It's just saying that someone didn't spend the additional, $30–40 million to do a full-blown study for the FDA to add an on-label indication for it. So that to me is a little bit of, a lot of bunk when people try to say that. So the bottom line with epidural steroid injections is that they are a very effective treatment for pinched nerve conditions such as disc herniation, spinal stenosis, and whatnot. They're outpatient, very low complication rate, less than 1%, and they can be repeated every few months. You can do a series of injections, 3 injections over a period of 6 weeks, and then a few months later have it done again. Very low risk, and it could be great at preventing the need for a risky spine surgery. Nevada Pain Network has medical and interventional pain management specialists along with chiropractic, acupuncture, spinal decompression therapy. There are several locations of doctors that we work with that take over 50 insurance plans, including workers' compensation, personal injury, PPOs, Medicare, Medicaid, and self-pay. The one number to call for scheduling is 702-323-0553, and visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene, CEO of the Nevada Pain Network. Your pain stops here.